Welcome to Empowered Voices, Recovery to Resiliency. Woo. So today in our season 2 finale, we're discussing why wraparound services are critical in building resiliency. Little theme there, right? So the goal in the episode is to address why the comprehensive wraparound services and support offered by programs like Empowered in the title are essential for pregnant and postpartum individuals with substance use disorder, and how important it is for them to successfully navigate through their journey and achieve resiliency, journey of recovery, all coming together. So we'll be exploring how these services and resources create vital support networks. We'll actually talk a little bit about a principle near and dear to my heart, and also one of our guests, but you as well, and you as well, called SBIRT, S-B-I-R-T, Screening, Brief Intervention, and Referral to Treatment. An important tool, we'll get to it. I envision that at some point we'll have maybe a more significant chunk of time to talk about that because it's really important. Amani.
Yes, so today we are thrilled to welcome Dr. Andria Peterson. She is the co-founder and executive of Empowered. Dr. Peterson has dedicated her career to improving healthcare outcomes for vulnerable populations, with a particular focus on pregnant and postpartum individuals struggling with substance use. As a PharmD with extensive experience community health initiatives, Dr. Peterson brings a wealth of knowledge about integrated care models and the critical importance of comprehensive support system. Her innovative approach to combining clinical treatment and practical support services has transformed how we approach recovery for new and expecting mothers. And I just have to say really quickly, thank you so much for your program because it has blessed my life as well as so many other ladies and women's lives. So thank you for your vision that you made come true. And then also, I would like to introduce, we also have with us Rachel Mack. She's Empowered's director. Rachel Mack is a licensed social worker and licensed alcohol and drug counselor. She has extensive experience working with clients experiencing opioid use disorder, specifically pregnant and postpartum women. She has also worked in the outpatient setting as a substance abuse counselor and in the inpatient setting, providing level of care assessments and referrals to individuals seeking treatment for mental health and/or substance abuse. Rachel is passionate and dedicated in providing support for participants of the Empowered program as they navigate their journey from surviving to thriving. I also have to say as well, thank you, Rachel, because without this woman, literally that passion that we had just said, it's you can feel it. You can feel the love, the care. And that's also another reason why I'm here standing today. So went from surviving to actually thriving. So welcome, Dr. Peterson and Rachel Mack. Woo! Thank you. So happy to have you.
Thank you. And unless you're going to call Farzad Dr. Kamyar, I'm going to go by Andria today.
Perfect.
Well, yeah, look, I could sit and talk about you both for a really long time.
Yes.
We unfortunately don't have that much time.
Right.
And I want to jump into our topics. I want to start off with, the episodes that we create is called Empowered Voices, Recovery to Resiliency, empowered being the key word here.
Yes.
So I think it might be appropriate to have Andria start us off with, how the heck did Empowered get started?
Yes.
How the heck did Empowered get started? Yeah, I'm excited to be able to be here together with some of my very favorite people that have been such a big part of my journey with the Empowered program, truly. Yeah. Rachel was one of our very first hires. I met Farzad really early in the program, I think before we even had clients. And Amani, you were one of our first clients at Dignity Health that followed us over to Roseman University. So really grateful to you for putting your trust in us. Amani, when she read that very long bio that I did not sign off on, she hit on the fact that I am a pharmacist.
Yes.
And so I think that's something that's unique to me. And so I can tell you a little bit about my story because that's really where it started. I graduated from Roseman University of Health Sciences, which those of you that are familiar with it, that's where Empowered lives right now. And I was taught by some of their founders and I'm a product of Roseman University, and I'm grateful for all that the education I received there that gave me the tools to do this work. But I worked for 13 years as a pharmacist after graduating from Roseman. I did a residency at the University Medical Center of Southern Nevada, had a great experience there, and then I worked in a NICU, and I loved working in the NICU, and I loved the fast-paced environment. So those of you that know me know that I like to make a decision, and I like to go with it. I don't like to think too long. I don't like to sit on things too long. Rachel knows this about me. And so I really enjoyed that working, and taking care of these really small, tiny infants, sometimes as young as 23 weeks when they were born, and being part of that team. And I'd say roughly maybe 2016 or so, we started seeing something happen in our NICU that we really hadn't seen up to that point in time. And it aligned with the opioid epidemic that everybody talks about. And these were infants that were being admitted to our NICU for something called neonatal abstinence syndrome, and that's withdrawal. So any of you that have watched, I feel like Dateline has done series on it in 2020 and things like that, and they show these infants that are experiencing withdrawal. And we were not very good at taking care of them. So I think any of us that worked in the NICU at that time will own that we just, we weren't trained on it in school. It was something relatively new to all of us. And we had these infants staying with us for a very long time, and they were complicated and they had long length of stays. And so I realized at one point in time that, hey, we got to get better at taking care of these babies experiencing withdrawal, because I really like taking care of the critical babies. And, these babies with withdrawal are taking up some of our beds is kind of how it focused. And so started doing some research with our neonatologist, and I really have to mention the name Dr. Deepa Nagar. She was the NICU medical director at the time, and she was on board with it, and started doing some research and identified some great ways for treating these infants experiencing withdrawal. And we got good at treating infants for withdrawal. And our length of stays were much better, and these infants were having some great outcomes. But as we did that, I realized that this was a symptom of a larger problem. Yes. And that was substance use that was occurring during pregnancy. Mm-hmm. And so being a little bit naive, I thought, well, you know what, let's put it on our providers, because if they'll screen, then they can solve this problem for us so that we have even better outcomes in the NICU. And I'm really grateful for our OB partners, because they were very open and honest with us when we started doing some outreach with us. And they said, it's hard to screen. It's hard to be a part of the solution right now, because we don't know what medications are available for pregnant women with substance use disorders. We don't know where to refer them. We don't know who takes what insurance. This is really new. It's really complicated for us too. And I was really grateful for their honesty. And so I thought, okay, learning point here. We need to find a solution for our providers so that they have somewhere to refer these patients. A turning point for me personally that I always share, and those of you that know me are familiar with this story, is that at the same time this was going on, I was a new mom. So I'd had my second baby. His name's Crew, and Crew had reflux and was a very, very difficult baby. And I was losing a lot of sleep at the time. And so I would often come to work. I would be very tired from being up all night taking care of him. And there was a baby in the NICU who had a very long length of stay that was treated for NAS. And this mom, she was right by my chair. It was a very open environment where we worked, and she would come in every day. She would take a bus in the morning to get methadone, and then she would take multiple buses to the NICU, and she would sing to this baby, and she would read to this baby. She talked to her baby, and I'd hear her all day, just, taking care of this infant. And she had an open CPS case, and the social work team was very transparent about the fact that they didn't know if she was in a place in her recovery to be able to actively parent this infant. And we were all really rooting for her and cheering for her, because we saw the love that she had for this baby. And so after spending 90 days with us in the NICU, and just to give you an idea, preterm infants that are born at 24 and 25 weeks, roughly will have sometimes a 3 to 4 month NICU stay. And so this baby that was treated for withdrawal had the same NICU stay as an infant that would be born at, around 24 weeks, just to give you an idea of that. And as it came time for this infant to be discharged home, it became clear that this infant was not going to be able to go home with this mom. And she was really devastated by that. And we were all really devastated for her also by that. And on the day of discharge, I will never forget, because my baby kept me up all night. And I woke up at 1 a.m. and I wasn't back to sleep. And I came into the NICU that day, and we were getting ready to round, and I'm tired. I was grumpy. Crew was up. This is hard. It's hard being a mom. And they said, well, this baby over here is going home today. And this mom was so gracious with her story, because she was just really open about her experience. And this mom wasn't able to meet the foster family where this infant was being discharged to. And so she hand wrote a letter that she shared with the NICU team. And it was handwritten in pencil. And you could see where she had erased different areas, and she, had really put a lot of thought into writing this letter out. And she basically explained a little bit about how she had developed her substance use disorder and where she was at in her personal treatment, in her path to recovery. But she pled with this family and said, please take care of my baby until I can parent and take care of my baby myself. And she said, my goal is to wake up at 1 a.m. to take care of my baby. And in that moment, it was really, people have like just life-changing experiences where it's like, this changed me as a person. I was like, her goal is to do what I'm complaining about. Her goal is to wake up at 1 a.m. to be able to take care of this infant. And I think I just knew in that moment, I'm like, we can do better. And so to this day, when we think about different things around the program and, is it going to work for our clients? And as we, develop different things, I always think like, what would have helped this mom? What would have helped her through her journey? And just am really grateful for how open she was with all of us and with her story. And so with that, I went to the NICU medical director again, Dr. Nagar, and I said, we've got to do better. And so we continued to form partnerships, some really key partnerships at the state. I think that you guys interviewed Dr. Stephanie Woodard a few days ago. She was part of that journey, and the Director's Office of Health and Human Services. They've just all been wonderful partners for us. And we developed the Empowered program. And it started out, and Rachel's smiling because she, like I said, she was our second employee. But we knew that, our providers needed a referral source. And so we hired a social worker, and we promoted screening, which is SBIRT, that Kamyar was, oh my goodness, now I'm calling Dr. Kamyar, that Farzad was talking about. And we developed a pathway for providers to be able to screen and then refer for connections to care. And so that's a little bit about the birth of the Empowered program.
What an amazing story. Just how amazing, because it's truly helped me.
Well, it's dependent on clients that are willing to put their trust in us. I think a lot of people don't realize that this program is not it's not court mandated, it's not court ordered, it's not required. And so I think the beautiful thing about the clients that are participating with us is that they actively want to engage and they want to be part of something and they want to grow. And we really are grateful for that and respect that, because we're, fortunate to be able to be part of their journeys and part of your journey. And so we're grateful for our program participants.
And I can promise you, and I know I speak on behalf of all other of the program participants, we are so grateful to have a program like Empowered. I was actually just speaking with the client earlier today just about services, being truthful and transparent and being kicked out of those certain services because maybe you've had a case of relapse and whatnot. And I was sharing with her how this is the only program that I've been into. Granted, I don't know all the logistics behind certain type of programming, but this is the first program I've been a part of where I can actually be transparent and not get kicked out. Also be transparent and actually get help. Not shamed, not like, girl, you did it again. Why? You might as well start a new family. I say that all the time because somebody's told me that before. So just knowing that you guys are really here doing God's work is just absolutely amazing. And we appreciate you all.
Well, we're grateful for our team. And like I said, Farzad was one of the early partners. We had a psychiatrist that we were going to meet with, and we were curious about what he was going to be like. And he showed up, and we're like, he's amazing. And he's been part of our story ever since.
The only man we trust.
It's been a long journey, and we're grateful. We're grateful for Farzad for putting his trust in us as well, because of the time. I mean, I was a NICU pharmacist.
Right.
I didn't have a lot of experience in substance use disorder, so.
As always, for those that are listening, I don't know if you can tell, but for those that are watching, this is oftentimes a very tear-jerking story that Andria tells. I think we did a good job at holding it. I'm throwing up air quotes, holding it together this time. So thank you for sharing that. Rachel, what I want to hear from you is, as someone who has been there from the beginning. Tell me, what is it what were some of the gaps that basically you all identified that Empowered was looking to fill?
Okay. Some of the gaps that we were finding for our clients that were pregnant, and active in their substance use, was finding them an appropriate prenatal care provider as well as a treatment provider. So the gap that we feel that we needed to address that was providing our community partners with outreach opportunities and education, so that they can be more inclined to work with this population, not be afraid of them. I feel like that was one of the biggest challenges, was helping our clients get into prenatal care and maybe like detox inpatient options, so that they can decrease their substance use and maybe transition to one of the medications for opioid use disorder.
Yeah.
I would add to that a little bit too, that I think we found a gap in, we have a beautiful social work team and we're so grateful for them.
Yes.
But someone who has lived experience that can relate to that.
Absolutely.
And at one point we said, I've heard of a thing called a peer.
Right.
Where,
Yes.
do you know what I'm like? Do you know what that
Can
is?
you look this up on
Yeah,
Google
she
or
was like,
something?
I don't know what. I said, you managed a peer? She was like, I've never managed a peer before. And we were introduced to somebody named Quinny, which goes down the books. Quinny
Amazing.
I
Wimbush,
will
who's
never
part
forget that
still
job
part of our
interview.
team.
Yeah,
And so I
she's
think that was a
amazing.
gap that we didn't realize we had. But, you know, finding someone with lived experience that could relate to our clients. And then Amani hit on it a little bit, but at one point we were like, harm reduction, what does that mean? Like, we're seeing news articles on this. Is this something we should be doing? We don't know.
Right.
And so we did some research, and I think Farzad, you were a big part of helping us understand that, but implementing harm reduction. And so I think those were kind of like gaps in the program that we didn't realize, but we were able to implement relatively early in the process when it was still new and people were still trying to figure out what that looked like.
Right. Yeah, because other community partners that we worked with or that we learned about did not have those components. And so I think that's another part of Empower that's made our program so unique.
Yes. And I have to say, peer support, that was my go-to when I first started the program. I literally would call Miss Quinny as soon as I knew she was on shift. I was calling her because I needed her. It's nothing like actually speaking to somebody who has, like you said, that lived experience, who can, when they do call you out, you know that it's, they've been there, done that. Whereas if you have somebody who's never really lived the experience and they're trying to call you out, it's like, well, have you been there? Have you ever dealt with this? So I really have to say peer support is definitely a key component. And that's what made Empowered different for me.
I think too, education. We had some education
Yes.
gaps. So I'm a pharmacist. I understood the medication aspect of the approach, but didn't understand sometimes specific things about this population. And so I'm looking at Farzad because I think you were our solution, because we'd come to you and you played a huge role in educating us. And also a shout out to Dr. Brian Irier because he also played a role in helping educate us.
Yeah, and that's, I think, where basically I can attest to this because that's where our journeys or our paths crossed. So I was a psychiatrist at High Risk Pregnancy Center, where we have a program where we specifically provide like high risk obstetrics and maternal fetal medicine services in conjunction with classic sort of treatments, aka medications and some therapy for pregnant and postpartum individuals with substance use, opioid, let's call it opioid use disorder specifically. And then we had identified the million other things that I'm going to call quote unquote gaps that are in addition, right, to classic treatments. That's where I met Andria, the team, Empowered. And then we became sort of this, it was not a requirement because we don't require things per se in treatment, right? We meet folks where they're at, but we basically made it such that every single program entrant that we had would get connected to Empower. It was like we made that referral because it was so important. And ultimately, and this is what we'll get to because I'm going to ask Rachel the next question, is we saw success rates for our program and success rates for these individuals that were involved with our programs go through the roof. I mean, like, right? We're talking life-altering turnarounds. Not 360, that's ending up where you are, but
Right.
we'll call it
180.
180. So along those lines, Rachel, can you tell us, and then Andrea, you can embellish as well, is what, like, will you just go through, like, what are those wraparound services? What are those things that Empowered provides to individuals that come and seek y'all?
I think one of the most impactful services we offer is the care coordination, which is essentially case management. But clients have access to that service throughout their entire time of working with the program. So initially, when they start working with us, they usually have higher needs, needing to be connected to resources that are more urgent. Maybe it's treatment, maybe it's housing, maybe domestic violence resources. But that's where we start with our client. We do that assessment, determine what their most urgent needs are, and connect them to those resources, and then follow up on that. And again, they have access to that care coordination throughout the entire time of them working with the program. So the goal is, while they're working with us, is that we're helping them get to that point of thriving or resilience. And that's that care coordination piece is connecting them to those resources to meet their needs. A lot of times what we run into with the care coordination piece is that our clients need that support in finding those resources, navigating those resources, maybe an advocate to make sure that they can be seen in a timely manner. And then also sometimes they need that support for someone to accompany them in these appointments. And so that care coordination piece is essential. A lot of our clients get very overwhelmed with navigating resources or making these calls on their own. And we've seen it ourselves. Sometimes our clients will call a community partner and get a completely different answer than we will get.
Yes.
So the care coordination piece is huge because, again, it's connecting the client to those resources to address their needs. And thankfully here in Las Vegas, we do have a lot of community resources, but it's providing that support to navigate through them. I think that's a big piece. Another great component of Empowered, as we mentioned, is the peer support.
Yes.
Our peer support services have really been enhanced over the last couple of years. So where we are doing peer accompaniment, so that's a peer going with the client. We've learned so many things with this program from our clients. We've learned that our clients have usually little to no healthy support.
Yes.
So there's times that they're doing different challenging things in their life. Maybe it's just the DMV, the welfare office, maybe going to a shelter, maybe doing an assessment somewhere, to where they would like someone to be there with them for support. I know our peer recovery support specialist, Queenie, was at an agency for inpatient yesterday to help a client complete her assessment to do an outpatient program. So she needed some support to do that. So that's an amazing component of our program. And we also do house visits now. Our peers are the main ones doing them, but all staff are also doing house visits. And again, that's providing the support to a client where they're at in their journey, meeting them exactly where they're at, and then just providing that in-home care, whatever that looks like. It could just be touching base with the client. It could be providing them with the bundles that we provide. For the baby bundles we provide, we try to do some safe sleep education while putting together a pack and play. Again, just kind of having that casual conversation. Another thing we do big on is addressing the social determinants of health. So sometimes it's bringing the client a food box, bringing them clothing or hygiene products.
Yes.
So those are some of the big things with Empowered that I think is really impactful for our clients because, again, they have access to these services throughout the entire time that they're working with us.
Yeah.
And I have to add too, with those house visits, and this is what sets Empowered apart from all other programs, I struggle with organization. And so we have some power staff members that are excellent with organization to where they'll even come to your house and help you just get organized, because we know when your home is organized, you think better, your mind is better organized. And that's one thing that you can't get at any other program.
Right.
You know?
I know I need some of that actually in my house.
Girl,
Now that you're saying that.
I wish I was a client still.
Yeah. And since I've sort of been with you all as an outsider, as a partner from the beginning, what you mentioned, Rachel, sounds like I'm going to call it the original sort of services that were offered. Andrea, can you tell us like how things have evolved? Because now, I mean, I'm personally involved in things above and beyond, but it's like, and you drive a lot of this, which is, and now we're doing this, and now we're offering that. Can you
and I would just really like to emphasize that addiction is a chronic disease state, and we just meet you where you're at. A patient that's diagnosed with something, and I think, Farzad, you're great at doing this, but somebody who's diagnosed with diabetes is going to have different needs. It's the same thing with a substance use disorder. Everybody's going to have unique and individual needs. And I think we just really try to meet them where they're at with a service that they're willing to engage in.
Absolutely.
So beyond that case management and those peer support services, which is we're so proud of how we've been able to implement our peer support services, we also offer individual counseling. I think you guys have had Rachel Williams on. She's amazing. Group counseling. We offer different sober social activities, helping promote, healthy relationships. We teach lots of different classes. They range from anything, those sober social activities, to yoga.
Yes.
We do hairstyling. We've done photography. We like to have fun. Rachel likes to have fun. We have an amazing team, Krista. They come up with such great ideas, but sometimes it's really around things like women's health and prevention around, STIs. And for those of you that don't know what that is, it's sexually transmitted infections. So sometimes it's serious topics like that, but sometimes it's like getting out and having fun. And our clients really enjoy all of that.
They really do.
We also offer something specific in Southern Nevada called stage-based services. And we divide our clients up into those that are pregnant, those that are 0 to 12 months postpartum, and those that are 12 to 24 months postpartum. And we do different groups activities with them because we want clients who are at similar stages to be able to also form bonds.
Yes.
And so sometimes that's things around safe sleep and car seat safety. And sometimes it's like yoga during pregnancy, or yoga with your baby, or yoga with your toddler, cooking with your baby, cooking with your toddler. So we really, like to encourage participation in those, and are grateful also for the opportunity that we have to have access to experts at Roseman University. We're a health sciences university. So we bring in faculty members from our dental program and our nursing program and our pharmacy program, and they offer additional health education for our clients. And when you look at, the recommendations from SAMHSA, which is a national organization, they have different things. And it doesn't just say, we want you to have medications for an opioid use disorder. It says, we want you to find purpose. We want you to have overall health. Help me out, guys.
Community.
We want you to. Rachel knew I needed help. She
Community.
read, this is how long we work together. We want you to have community.
Yeah.
I love it.
But those four. There's 4 pillars. That's 3.
Stability.
Thank you.
I got you.
I'm really just trying to
got you.
get rid of the scratchy throat at this point in time. But it's about overall meeting somewhere they're at, offering them a service that they'll engage in, and achieving overall stability, which goes beyond just a medication. Medications are an important part, and I want to emphasize that they're so important, but it's also healthy and important to be able to build that overall health and wellness and stability to be able to thrive, because we want them to achieve a sustained recovery.
Yes.
And that's how you reach resiliency.
Tools in the tool belt.
Yeah. I said a lot of that without coughing, so I'm really proud.
And along those lines, I want to hear from both of you on this one, is how important, because Andrea, you had mentioned it's more than medication. It's more than that sort of classic treatment. How important are these, I'm throwing up air quotes again, are these wraparound services addressing social determinants of health and things like that, which are services that sort of empowered assist with? How critical is this to recovery?
It's so critical because there's enough barriers and challenges that they face in the community, going to different appointments and different providers and just navigating that. I think it's very critical for as many services to be offered in one spot, and to have that multidisciplinary team that can support that client based on whatever their needs are. I think it goes a long way, especially because all of the challenges and barriers that this specific target population faces.
I'll never forget, I think one of the first clients that we helped, we were so excited that we had a referral, and it was from an OB, and we were like, this is great. Let's get her into prenatal care and treatment, and she's going to be like awesome. And then we figured out she didn't have an ID, I want to say.
Yeah.
And she needed a government-issued ID, and we're like, awesome. Let's go to the
problem.
DMV and get her. And then took her to the DMV, and she failed the test, and she was like, oh yeah, I can't see because I don't have glasses. And we're like, okay, so you can't get your because she wanted a driver's license. She was very spit, and we can't. Okay, we want to get you an ID, and you want a driver's license, and you can't pass the test because you can't see. We'll go to the eye doctor. And she's like, I forgot to tell you, I don't have insurance. And I'm like, okay. So
Backpedal.
our first thing is we thought we wanted to get you into prenatal care and treatment, and we were going to be so proud of ourselves. And then we thought you just need an ID. And then we realized that you needed glasses. And then you realized that you didn't have insurance and you don't have an ID to be able to get these things. And I think that was just like so impactful. And I'm grateful that I think that was one of our first cases. And we were like, oh yeah, this might be a little bit more complicated than we thought than just treatment. And so we understand those that think, hey, we want them to get into treatment. We want them to get prenatal care. But if you're experiencing homelessness, if we, help you find a prenatal care, provider, but if you don't have a reliable form of transportation and a reliable place to sleep and stay, it's unlikely that they're going to engage in that treatment.
Right.
And so that's where it comes in. What's your most urgent need? What do you need right now?
Yes.
Like, what can we help you do right now to be able to access the services and the care that you need? And not only does that help them on their journey, but it helps build trust with our team. And sometimes, is things like, I need clothing. Sometimes it is, I need prenatal care. Sometimes it needs treatment. But I think the first time you hear somebody say that their most urgent need, which I've heard is, I need food, is something that stays with you.
Yes.
And you're thinking, wow, all this person needs right now is food. They are hungry right now and they don't have food in their home. And so I think we need to really manage expectations. And that's why it's so important to provide access and wraparound care, because they go hand in hand and you can't have one without the other.
Right.
Yeah. Amani, you were on that side that we're talking about, right? So sort of on this, can you tell us how critical was it
Yes.
for you?
I definitely have to say that Empowered really is your one-stop shop. And that's honestly one of the reasons why I wanted, I always say Empowered worked for me. Everybody always corrects me and says, no, you worked Empowered, And so one of the main reasons why is because everything is in one spot. I know we have advocacy, linkage to care. I mean, all of this is in one spot. So Empowered helped me figure out the steps to get my ID. They also have helped me do so many things that I know I would never have done because, first of all, without transportation, because when I did join Empowered, I was currently homeless. I did not have my own place at the time. And so I'm just really trying to figure out, where am I going to live next?
Yeah.
I can't bring a child into this world with not having stable roof over my head. That's a CPS case. So
Exactly.
trying to figure out where, that step, let alone go to my doctor's appointments, which at the time, the transportation was very flaky and shaky. So missing those appointments, just not even knowing. I never really had my high-risk pregnancy. I know I probably should have. I did link up with Empowered later on in my pregnancy, but I know if that was something that I would have explained to you guys definitely would have made sure I had high-risk pregnancy for sure. But there's so many things that I wouldn't have done on my own. I'm just worried about, where am I going to live? I can't. And then also, like you said, food. I've been hungry so many times, and it's a blessing to be able to go into Empowered and know that they'll have a few snacks for me. Not a 3-course meal, but they have something for me to eat just so I can be able to think and process certain things. Because I know Snickers is right. You're not yourself when you're hungry. Well, you can't even think when you're hungry. Yeah. So having everything in one place, it is truly just a game changer and a lifesaver. I really, like I say, there are other programs that do it too, but not like Empowered. Right. And it's the love also that comes behind. That is actually one of our screening questions is, what are your emergent needs? That's something I ask every person. And I love it because you guys still give us the power and the control over our lives, but you also help us prioritize what's really important. Like, I know when I started, getting my son back and, getting clean is my first priorities. Well, it's like, how are you going to have your son if you're still using? Yeah. How are you going to have your son and you don't have roof over your head? How are you going to get him? Now, once you get your son, how are you going to get him to and from school? Never thought about that. Right. I'm going to have to get up early on the bus, So having somebody to really help you process certain things. I know I had a CPS case, program care manager, Yvonne, she helped me. Actually, everybody on the staff helped me out. And certain things like that, everybody hears CPS and it's like, dun, 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 I'm scared. Let's just give up on life. They're going to take my kid, and having Empowered to be able to advocate for me, help me come up with a game plan with CPS. That's just absolutely amazing. You can't say one spot does all of these different things. And I know there's tons of things that I'm missing too.
Sure.
I think one thing I wanted to add for the new clients coming in, sometimes when they're just wanting food, we've had a good amount of clients that come in are just wanting hygiene products and clean clothes.
Yes.
Or shoes that fit so that they can move forward. I know that sometimes that's a barrier to go into your prenatal care appointments if you don't have the proper hygiene product to keep yourself clean. A lot of our women are challenged in that area, especially if they are homeless. And so I think, like you said, Andrea, it helps the clients build the trust with us as a program. When we're meeting that need, that first day that we meet them, you know what, here's these clean clothes, here's some hygiene products. We have a bathroom right here. Take your time. We'll get ready as soon as you're finished, and we can move forward. It goes a long way. It goes a long way.
We say one-stop shop, but really we're also very dependent on our community.
True.
Because we've got our team in one spot. We're grateful to have a social worker and a peer and to accompany you. But we're so dependent on community partners to be able to access those services. So we do not do it on our own. And we are so grateful for our community partners because they support us in so many ways, and they support our clients and literally the work
possible.
The work we cannot do the work we do without them. So we are very grateful to them.
Yeah. My answer to the question is, it's the difference between life and death.
Yes.
So that's how important I see these wraparound services to fill in the adjective, supplement, complement,
Yes.
all those adjunct are standard medical treatments.
Yeah.
In this world of, let's call it fentanyl, who knows, by the next season, it's going to be some other substance
Yes.
that's murdering everybody. Murder, because it's murder. These things become even more important, right? And when I'm comparing it to other medical conditions, let's go diabetes. Andrea, you've mentioned diabetes. If I have a patient who is suffering from diabetes and they're in standard treatment with medications and we're following programs, at the end of the day, I don't really have this imminent concern of if that person leaves my office and they quote unquote experience a return or a relapse, I'm throwing air quotes, that they're going to drop dead. That's really low on my list.
Yeah.
But when I'm treating someone who has a heroin and opioid in general, including fentanyl use disorder, when they leave the office, I'm concerned.
Yes.
Yeah,
Because
sure.
if they experience a return to use, that return to use could expose them to fentanyl, and that's where like the saying "one pill can kill" comes into play, and they drop dead. Game over, right? Game over. So, food, like you don't have food, and I'm asking you now to go to a pharmacy to pick up a medication and come to my office. Right. This stuff is so important. What I'm really excited about is at Roseman starting the new College of Medicine, and we have students starting in a couple months. All of what we've talked about, basically the Empowered program. There's also a program at Roseman called the Genesis program, which is like the home-centered, right, care. It's this. And it's so important that it's a requirement for our students. So it's part of medical training now, because when those folks enter into their specialties and hit the community as part of the healthcare system, we need them to be able to understand and identify and empathize with the fact that this is the difference between life and death.
Yes.
Yeah.
When we talk, about a simple screening tool that can save lives, because we have lots of different screening tools in medicine. You touched a little bit earlier about something around SBIRT, and that stands for Screening, Brief Intervention, and Referral to Treatment. And it's an evidence-based mechanism. You can use really any screening tool that's validated.
Yeah.
There's ones for different populations, but it has the potential to save lives because it's essentially screening, using a questionnaire to say, hey, you have been identified as possibly having a substance use disorder, or you could develop a substance use disorder. There's resources available and there's help, and I'm going to connect you to that. So whether that's a phone number or a social worker or a website, whatever it is, but it saves lives. And it's a very simple thing that really anybody can do. It doesn't have to be, specific to a physician. It can be anybody who's in an office. But that screening and the way that can be communicated can literally save someone's life.
Yeah.
There's help. There's resources. I'm going to help you.
That's amazing. Well, even just that right there will already help somebody. Hopefully more practitioners will just reach out and tell us, we're going to help you, because sometimes that's all you want to hear.
Yeah. And again, yes, we did talking about SBIRT, right? Screening, Brief Intervention, Referral to Treatment. Andrea, you've talked about screening, how important that is. Just to sort of reiterate, it is the standard of care. It's the best practice. It's the gold standard. For mental health, which includes substance use disorders, we currently do not have a test. I don't have a blood pressure I can take. It's not part of a vitals. I can't send you through an imaging machine like an MRI or CT. What commonly, and this is a misconception, is that if I have you give me a sample of urine, what we call biologic testing, in a cup, and I test it for substances, that is validated screening. And I'm here emphatically getting closer to the microphone to say that is not a best practice. That is not what we should be doing. That is not appropriate in this day and age as a form of screening. Some basically validated questions. That's how we screen for mental health disorders, including substance use disorder. But that's the screening part. And how important is this? Again, life and death. I want you all to think in a parity level, which means equality to other physical ailments. is it's the equivalent of you going to a clinician's office and them not checking your blood pressure. Just so you know, that's them screening. That's
It's a
the
screening
validated
tool.
screening
Yeah.
tool for high blood pressure. That's why they do it. And how often do they do it? I'm pretty sure every time you've gone somewhere.
Maybe multiple.
But then the
Right.
question is, when we've said as sort of medical experts in major national societies, that when you engage with someone who's pregnant for the first time, you're coming in for your first prenatal visit, the standard is to ask them the validated questions
Yes.
for screening for mental health and substance use. And is it happening, Andrea?
I would say at low rates.
Low rates.
It depends where you're at, but it's fairly low rates.
Yeah.
Which is why it's important that we train our students
Yes.
early on in their education the importance of using this tool. But it's also important that we train our current residents and our providers.
Yeah.
Yeah. And I think so, and screening is how we identify folks who might benefit from. So that's basically what has them sort of get referred to Empowered. But when they're at Empowered, so the screening happens. Rachel, can you tell us a little bit about the BIRT, which is brief intervention and referral to treatment part that we do at Empowered?
Yeah. So it's
The BIRT.
The
Yeah. So it's kind of talking to the client and kind of understanding what their needs are, what they're open to, letting them know that there are resources available, and kind of giving them that moment to, if they want to share, if not, that's okay. But just ensuring them that there is hope, there's help available, and there's resources to meet their needs, and providing them with a list of those resources so that they have them whenever they're ready. And I feel like a lot of our clients, when they come in, they all wish that they learned about our program sooner.
Yes.
A lot of them are like, wow, I
Yes.
wish I knew about you in my last pregnancy, and things like that. So a lot of them want that opportunity to be screened so that they can get the help that they need.
Yes.
And I think it's important to talk about why do we place so much emphasis on the population that we do. So we're talking about pregnancy and 1 year postpartum is when you can be delivered, referred to
Yes.
Empowered. Do you want to talk a little bit, Farzad, why aren't we doing this for reproductive age? Because that's an important population as well. But why is pregnancy and 1 year postpartum more, kind of just a really, really special population? Because it is. It's a very special
Very special.
population.
Yeah, naturally, the answer for during pregnancy is you're talking about multiple lives, right? Classically, with a single pregnancy, we're talking about mom, the birthing individual, or
Yes.
the individual that's carrying the fetus, and then the fetus that becomes the infant, or the neonate, that's the infant. So what are we talking about? We're really talking about generational effects.
Yeah.
Yes.
Generation, and we see this. We can have a whole episode where we talk about generational stuff that's happening in DNA. I mean, this is like wild, right? But it's not just right here, right now. It's right here, right now, and 50, 60, 70 years in the future. Like entire trajectories of this household can change based off of this, what we call an ideal window of opportunity to have someone engage in treatment, which is pregnancy.
Yep.
So super important. Why postpartum? Well, baby's born now. This is actually the most critical time. Our evidence shows that the first year postpartum actually has folks at the highest rate or risk of overdose. And so it's not that, woo, we made it through pregnancy, you're good, hasta la vista. No, now it's like, if we didn't have all hands on deck before, now we need even more hands on deck. Now we need pediatricians on board. Now we need WIC on board. I mean, there's so many other, these wraparound services that are even, I would say, more important, not to diminish pregnancy or really anyone else who's in treatment, right? But just to sort of emphasize this, here in the state of Nevada, pregnant and postpartum individuals have been identified as basically the highest priority demographic population. So a lot of our efforts are going towards it.
And I think it's important to note in that postpartum period that it's not immediately after birth, because I think that then our minds go to, we want to make sure that we offer support right after birth, which is also extremely important. But it's actually, I want to say days like 43 or 45 after delivery, up to days 365 after delivery. So we're looking at like a month and a half up to a year after delivery is the highest risk for overdose. There's a couple factors that play into that. It's hormonal changes and shifts. So there's things physiologically that change. But also, if there's return to use, there's the risk that an individual is going to use the amount of a substance that they were using prior to, abstaining from using substances, which can result in an overdose.
Yeah.
And so I always just emphasize pregnancy is so important, but it's equally important to support the postpartum period.
Yes.
And that's why this patient population is priority and why we have the focus that we do, because everybody deserves access to care and everybody deserves resources and treatment, and really want to emphasize that. But there's a reason that we really focus on pregnant and postpartum patients.
And I guess I'll sort of conclude on this topic, or this point is I've done some pretty tough stuff in my life. Medical training, residency, being up 2 days in a row, covering entire hospitals.
With kids, I think. Have kids at the same time. So
having kids was the single most difficult thing I have ever done. It effectively broke me numerous times. So I cannot imagine what an individual with a substance use disorder, and now being a multi-parent or a new parent, holy smokes. So kudos to all of you who are in that situation and doing your best to stay alive. It is not easy. And really, you guys are engaging in I think the single most difficult thing that humans have to take on, which is recovery.
Yes.
I talk about, I call, rocket science, brain surgery, those kinds of things. There are a lot of tough jobs out there, but I think that the most challenging thing that a human can engage in is the act of recovery. So many things in the brain are directed at a elemental Maslow's hierarchy of needs, that this substance is now more important than water, food, shelter. And now we're basically saying, let's reverse that and focus on other things. But anyhow, for a different conversation.
the change is possible, and there's hope, and there's resources.
Yeah. Parting thoughts. Let's go, Rachel.
Thank you for listening. This was awesome. Thank you for having me. I hope that the summary of this podcast is for people to see that this program has been really beneficial for others, and we're hoping to meet as many clients as we can in the community, address as many needs and gaps and barriers, and continue to do the work that we really do love to do.
Yeah. Thank you so much for being here.
Thank you for having me.
And I thought a little about, heading into this today, about other messages that I wanted to convey in this, that there's hope and change is possible. But also you can make a difference.
Yes.
Because I was a NICU pharmacist that had never participated in advocacy work before. And I think sometimes right now we always wonder, what can I do? Or I feel really strongly about this. What can I do? And the answer is you can influence your sphere of influence and your circle. And I started at the hospital. I started out with policies at my hospital in my NICU. And, then I went more to a community level and a state level and programmatic level. But, find what you're passionate about and influence your circle of influence, because we can all play a role in change in different things.
Yeah.
That is so true. And you went from policies, you went from policies to truly changing my life, I can speak on. And I really just appreciate all of you guys. I really appreciate the Empowered program. I know this isn't an appreciation episode, but I mean, how can you not just share how grateful you are for a program like Empowered? Literally, everything you guys say, you guys do, and you guys don't even say all of the things that you guys do. So there's always tons more that Empowered's doing for each and every client's life that they touch. So that's my parting thoughts. Thank you, Empowered, for everything.
Thank you. And I think it's hard to say thank you without, again, recognizing our community partners and also the different funding sources and those who play a role in that, because they often don't get to see the work and they don't get to see the clients and the success stories, and they have really hard jobs. And, the work we do isn't possible without all of these people doing the work that they do.
Yes,
it really takes a village.
It does.
And we're really grateful for the support that we receive on so many different levels.
Thank you, community partners. Thank you, everyone who's making Empowered possible.
It's a lot. It's a lot.
Yeah, that would be sort of my parting statement as well, is thank you to everyone who's involved from all aspects. I mean, the umbrella is massive. We're talking thank you to patients. We're saying thank you to clinicians. We're saying thank you to legislators. Thank you to first
state
responders,
officials, health district people doing screenings.
Grant writer. Everybody.
Grant writers. We'll shout out to Troy today.
Yeah, absolutely. And why? Because it is life and death.
Yeah,
And if-
absolutely.
If, you know,
Literally.
we touched about this, how important are all these different things? Yeah, absolutely critical. One little piece isn't there, and for one individual, that might mean overdose. And if another piece is not there for another individual, that might mean overdose. We can never tell. But
Yeah.
that's why it's important to have programs like Empowered. That's here in Nevada. There are programs that replicate the same all throughout the nation. It
Yes.
is critical that we continue to fund, continue to make available.
Yep.
Yes.
And find a program that works for you.
Yeah,
Right,
and find a
absolutely.
program that works
Amani,
for you.
I think, says that. Find a program that works for you.
Yes,
Yeah.
yes, it's the truth though. You have to. You
yeah,
have to.
Yeah.
And educate yourselves and others to have a little empathy.
Yeah.
Well, I'm sad. I'm sad to be concluding. But,
Thanks, guys.
Yeah,
Thank
thank you.
you.
So, thank you for listening or watching to this final episode of Season 2 of Empowered Voices. We plan to be back with a Season 3 soon. Hopefully, fingers
Yes.
crossed. Be sure to subscribe wherever you get your podcasts so you don't miss any future episodes. We have a lot more to talk about.
Yes, we do.
Also, don't forget to rate and share with others who may find our information and discussion topics helpful. Finally, if you visit our website, which is empoweredmoms.org/podcast, you can share your thoughts, ask questions, or suggest topics to be discussed in upcoming episodes. On behalf of me, myself, Amani, the entire podcast team, and all of our guests and everyone who's been involved, thank you for joining us.
And
Yeah.
thanks
Yes.
for putting up with
Yeah,
my
thank you.
scratchy voice.
And I have coughed a few times too.
Not as much as me. Thanks,
Thank
guys.
you. If you live in Southern Nevada or in Reno, Carson City, Churchill County, or Lyon County in Northern Nevada, or Weber County in Utah, and you're pregnant or recently had a baby and using opioids or stimulants for any reason, there is non-judgmental help available to you. No referral or insurance is required. Visit empoweredmoms.org for information or to request services. If you live outside these areas, we encourage you to find resources in your community.
Empowered Voices is a podcast production of the Empowered program at Roseman University College of Medicine, supported by the Centers for Disease Control and Prevention's Overdose Data to Action grant through the Southern Nevada Health District. This project has been funded by grant number NH28CE003534 from the Centers for Disease Control and Prevention. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by the Southern Nevada Health District, CDC, or the U.S. government. Hosted by myself, Dr. Farzad Kamyar, and Amani Wilson. Executive producers are Dr. Andria Peterson and Jason Roth, with production assistance by Rachel Mack. Recorded at the Video Podcast Studio in Las Vegas, Nevada. For more information about this podcast and past and future episodes, visit empoweredmoms.org.